Another domain, and the greatest concern, is of harm to patients from undertaking these new interventions. There's risk of increased morbidity and mortality, and therefore it's important to have stringent quality improvement programs, review every case, and use the learnings to iteratively improve for the next case. There's also a risk of loss of trust in the medical system on behalf of individual patients if they have adverse events. And there it's important to frame the intervention as being something that is new and does have some increased risk, so that patients are prepared for the adverse outcome and won't use it to then not pursue other care they need. A very interesting ethical domain arises from the potential remote distance between the patient and the physician, which has the risk of producing a diminished physician-patient relationship. There is a potential for reduced access to the interventionalist, and there it's important to maximize one's availability, use telemedicine to interact with the patient both before and after a remote tele-intervention, and be ready to transfer the patient to a mothership comprehensive care center for direct care after the intervention. There's a risk for lessened interpersonal and nonverbal connection with the patient, that the patient may not have as good a feel for their physician as they would with an in-person encounter, and their physicians can help when they have telemedicine interactions with the patients by using more emotional vocal and facial expression to convey information in nonverbal channels that body posture would convey in person, and also to ensure that local personnel, nurses and local physicians who are part of the team, have good, warm body, in-person relationship with the patient. And finally, the interventionalists need to guard against having decreased empathy for a patient and their family member who is remote from them, and have to work to cultivate with extra attention the empathic feeling for the patients.